Roadblocks to Rabies Elimination, Overcoming Barriers to Eradicating Rabies. Rabies is a disease that can be prevented through animal vaccination. Unfortunately, despite vaccination efforts, cases of rabies still occur. Rabies is a viral disease that affects the nervous system of mammals, including humans. The virus is usually transmitted through the bite of an infected animal. Animal vaccination is one of the most effective ways to prevent the spread of rabies. Exploring the persistence of rabies, despite the availability of a vaccine. Despite the vaccine's presence, rabies remains a prevalent disease. This begs the question, why is it still neglected? Possible factors that contribute to this issue include insufficient funding of efforts to eliminate rabies, limited economic impact, a lack of awareness, or minimal societal pressure to eliminate the problem. The connection between rabies and poverty. Rabies is a disease that is often linked to poverty, resulting in a lack of understanding of its origins and severity. People may not fully comprehend the way in which rabies is contracted and the extent of its dangers. Although bites are widely recognized as a risk factor, less serious or non-bite exposures, such as those involving bats, are frequently disregarded or misdiagnosed, even in highly developed nations. Additional methods of rabies prevention. Aside from practicing caution around infected animals, there are also two other methods of preventing the spread of rabies: post-exposure prophylaxis, PEEP, and pre-exposure prophylaxis. Pre-exposure prophylaxis is particularly recommended for individuals who are at high risk of exposure to the virus, such as animal workers, frequent travelers, and those who reside in locations with limited access to PEP. Additional methods enhancing rabies management in low and middle-income nations. Despite the significant advancements made in rabies control, low and middle-income countries, LMICs, have not made comparable progress to other regions of the world. These countries have yet to execute mass dog vaccination, MDV, programs on the necessary scale and duration to eliminate rabies, and access to post-exposure prophylaxis, PEP, is still restricted. Additional factors contributing to the persistence of rabies are poor health-seeking tendencies and inaccessibility to post-exposure prophylaxis. If individuals lack access to post-exposure prophylaxis, fail to follow recommended protocols, or refuse post-exposure prophylaxis altogether, it increases the likelihood of acquiring rabies. Another contributing factor is insufficient surveillance in laboratories. Improving worldwide access to rabies prevention, post-exposure prophylaxis, PEP. In order to reach the ambitious objective of eradicating human fatalities from rabies worldwide, it's crucial to have access to PEP. Despite the fact that some high-income countries have successfully eradicated endemic rabies, the demand for PEP remains high. However, many African countries face challenges in accessing PEP, with patients often required to travel long distances to receive treatment. Unfortunately, very few low- and middle-income countries, LMICs, offer free or subsidized PEP at subnational levels or primary care facilities. Additionally, Africa and Asia have no vaccine banks for PEP. Thankfully, Gavi, the Vaccine Alliance, has recently pledged support for human rabies vaccines in its vaccine investment strategy from 2021. This positive development gives hope that PEP access will improve in the near future. Preventing rabies with PEP, understanding the role of REG and the latest research. Post-exposure prophylaxis, PEP, is a method of rabies prevention that involves timely and complete vaccination, as well as the administration of rabies immunoglobulin, RIG. However, recent studies have revealed that complete vaccination alone may be sufficient in preventing rabies, negating the need for RIG. This is particularly good news for low- and middle-income countries that have limited access to RIG. Exploring the benefits and challenges of integrated bite case management, IBCM, in rabies control. IBCM is a recent approach that aims to reduce human deaths from rabies by using PEP more prudently. This One Health approach involves identifying the health status of the biting animal to inform the use of PEP and minimize unnecessary treatments. In low-risk settings, IBCM has the potential to reduce overuse of PEP while improving access to it in high-risk settings. 3 studies that trained health workers in IBCM showed a general improvement in risk assessments and PEP delivery. However, there are challenges to its implementation, including a lack of funding for animal health workers and limited intersectoral coordination due to the rigidity of human health and veterinary systems. Consolidating resources and promoting strong health service networks not only reduces costs, but also optimizes resources, thus maximizing the impact of each dollar invested. Through collaborative rabies programs, disease prevention and readiness are prioritized, creating a model for One Health collaboration. 0 by 30 Plan for Rabies Elimination. Investing in the elimination of rabies not only saves lives, but also improves human and veterinary health systems. By strengthening the surveillance mechanisms for other illnesses and increasing access to health care, rabies surveillance activities become a fundamental element of elimination, fortifying the health system. The United Against Rabies collaboration's primary objective is to employ existing tools and expertise in a coordinated manner to empower, engage, and enable countries to prevent rabies. The latest global strategic plan places countries at the forefront with renewed international assistance to encourage action and drive change. This country-centric approach is adaptable and tailored to suit various circumstances and abilities. United Against Rabies, collaborating to end human deaths from dog-mediated rabies. The World Health Organization, WHO, the World Organization for Animal Health, OIE, the Food and Agriculture Organization of the United Nations, FAO, and the Global Alliance for Rabies Control, GARC, have united to form the United Against Rabies collaboration with one goal in mind: to end human deaths caused by rabies by 2030. 0 by 30 Plan for Rabies Elimination. Investing in the elimination of rabies not only saves lives, but also improves human and veterinary health systems. By strengthening the surveillance mechanisms for other illnesses and increasing access to health care, rabies surveillance activities become a fundamental element of elimination, fortifying the health system. Sustaining the fight against rabies, WHO's 5-year plan. The World Health Organization, WHO, has set an ambitious goal of eliminating dog-mediated rabies by 2030. To achieve this, it's imperative to establish a sustainable global rabies response within the next 5 years. This means implementing a phased and multi-pronged strategy across all affected countries, with close collaboration between the human and veterinary sectors and the wider community. Engaging communities and healthcare professionals to raise awareness of the problem and prevent bite exposure is crucial. Additionally, managing dog populations and ensuring herd immunity through dog vaccination is necessary to control transmission. Lastly, providing post-exposure prophylaxis and adequate care for victims is essential in achieving this goal. Thanks for tuning in. Don't forget to show your support by liking and subscribing to the Infectious World channel.